Well, it's now complex. We used to discuss the trade-offs between the safety and efficacy of VEGF TKIs, where interestingly, for example, for sunitinib or pazopanib, we talk about chronic side effects with the patient as the major safety and toxicity issue, but also we did not have a demonstrated overall survival advantage in trials. We got close in a couple of them. The discussion now is somewhat different because of the emergence in first-line therapy of cabozantinib with different toxicities. One would assume more toxicity than drugs like sunitinib, but in head-to-head trials, toxicities that are a little bit worse but not majorly worse, and certainly different toxicities and the need to regulate dose up and down. The other issue with cabozantinib is that unlike pazopanib or sunitinib, it has demonstrated an overall survival advantage in the second line against another active agent. So it's a powerful drug, and that's a discussion, that's a point that I'll introduce into discussion with the patient. So if they have definitive evidence of living longer, that's an issue. And then finally, the combination checkpoint inhibitor therapy with nivolumab 3 milligrams, ipilimumab 1 milligram, producing an overall survival advantage. That's a very important issue for patients that have intermediate and poor risk. And I think the trade-off with the side effects in that regimen can be considerable, or they can be negligible. So we have patients that just breeze through the stuff, particularly the first 12 weeks with 4 doses of relatively low dose ipi, and you have other patients that really get significant problems and are not able to have therapy beyond the second dose. So there's a kind of spectrum there, and that's important for the practicing oncologist because this regimen is easier to manage than the higher dose ipi regimens we've used for melanoma now for almost a decade. But there are still patients that have difficulty tolerating it, and so you need to have a contingency plan as well as a toxicity management plan for those patients.